Thank you. Yang berbahagia, Datuk Seri and Senior Dr. Zaini Ujang, the Secretary General, Ministry of Higher Education, Malaysia. Mr. Hao Yang Zhu, United Nations Under Secretary General and UNDP Associate Administrator. Yang bahagia Tan Sri Jamila Mahmud, the Executive Director, Sunway Center for Planetary Health and co-chair of the summit. Dr. Mary Stoddard, Executive Director, Planetary Health Alliance and co-chair of the summit. Professor Dr. Elizabeth Lee, Chief Executive Officer of Sunway Education Group. Professor Sabandris Popima, President and Vice Chancellor of Sunway University. Bear with me, it's quite a long salutation though. Ms. Karima El Khoury, the UN Resident Coordinator, Malaysia, Singapore and Brunei. Mr. Niloy Banerjee, UMDP Resident, Representative for Malaysia, Singapore and Brunei, Darussalam. Yang berbahagia Datuk Dr. Nur Fariza Ngah, the Deputy Secretary General, Ministry of Health, Malaysia. And Mr. Ong Pang Yen, the Executive Director of Chairman's Office, Sunway Group. Distinguished speakers, esteemed participants, ladies and gentlemen, let me begin by my usual salam of Assalamu alaikum and a very good morning to all. Salam Malaysia Madani. So that salutation was long enough, and this speech is going to be longer. I'm not quite sure whether you will survive with me, but as Tan Sri wanted you to close your eyes, I would allow you to close your eyes. But make sure you wake up before I conclude my speech. That will make this speech a lot shorter, I trust you. Now let me begin by expressing my deepest gratitude to the co-hosts of this summit, the Sunway Center for Planetary Health at Sunway University and the Planetary Health Alliance for organizing this very timely and critical event, and more importantly, it is done here in Malaysia, and the seat and the genesis of planetary health as advocated in Malaysia by none other, the teamwork of Tan Sri Jamila and Tan Sri Jeffrey Chia. Let's give them a big round of applause. From Malaysia's perspective, it is fitting that this annual meeting is held in the heart of Asia for the first time, because this is the first Planetary Health Summit 2024. This is a testament to the growing recognition that the health of our planet and its people, no matter where we are on this global home, are inextricably linked. The theme of this meeting, from evidence to action, confronting reality, is a stark yet necessary call. Climate change, biodiversity loss, environmental pollution and the related threats to planetary and human health are no longer distant or abstract. Southeast Asia has been experiencing heat waves more frequently since 2016. This year's Hari Raya or Eid celebration, as we are still in the mood of Hari Raya, had been a hot affair in the sense of the heat stroke and whatnot. Severe flooding in increasingly prevalent, which is in turn had led to an increase in vector-borne diseases such as dengue fever. The decimation or destruction of bee populations upon which we are so reliant for pollination is disrupting food production, increased interaction with wildlife, inter alia, due to deforestation, had increased the proliferation risks of zoonotic diseases. The fact that up to 240,000 microplastic nanoparticles can be found in 1 liter bottle of drinking water raises the alarm on neuroendocrine disorders ranging from non-communicable diseases to cancer. For too long, we have viewed these issues through separate lenses. Today, let us together say, no more. As we are now at the critical crossroad, we must ask ourselves the tough questions. Should we remain and maintain the business as usual approach without changing our system and behaviors, or should we embrace short-term inconveniences for the sake of a long-term solution to our dilemma, trilemma, and what have you? Within this decision, there lies a profound opportunity for collaboration, innovation, and decisive action. In this hall, we have thought leaders, policymakers, industry experts, indigenous voices, young minds, and others that represent the strength that we need. Malaysia is keen to play and assume its part. Planetary Health resonates well with the Prime Minister's vision for the future of our country, Malaysia Madani, which aspires to ensure that all Malaysians have access to basic necessities such as food, shelter, and healthcare, economic growth that is balanced with social and environmental responsibility, the ESG, Malaysia's natural resources and biodiversity are protected using principles of sustainability and environmental stewardships. The government is transparent, accountable, and responsive to the needs of our people. We can celebrate and promote the country's cultural diversity while also creating a sense of national unity. Such an all-encompassing approach is important if we bear in mind that 75% of determinants of health are social, economic, environmental, and political in nature. And I would dare say at this juncture, while sitting and listening to the various speeches, that Planetary Health, if I could say it off the cuff, has surely become a macro-critical economic, social, political, and health imperative that must be addressed by all governments of the world, in all supranational government, be the United Nations or WHO, ASEAN, and others. As such, the Ministry of Health Malaysia is also firmly committed to the principles of planetary health. The Health White Paper, approved by Parliament in June 2023, lays down a visionary framework for a resilient, equitable, and person-centered healthcare system. Through our sustainability program, a key aspect of the carbon-neutral healthcare facilities blueprint launched last year, we will lead by firstly decarbonizing healthcare sector. Today, I'm proud to share some notable achievement thus far. By 2025, all hospitals in Malaysia are to be green certified. That's one. Secondly, the ministry's facilities had managed to conserve 897 gigawatt hours of electricity. Thirdly, these amount to 702,000 tons of carbon emission reduction and a cost saving of RM 377 million, while recycling had generated 5.6 million in revenue thus far. But these were neither straightforward nor as easy feat to achieve. Nascent green technologies are neither cheap nor easy to finance. Narrowing the skill gaps within our workforce need massive investment. Beyond that, implementing these changes requires sacrifices that explicitly recognize planetary health. We recognize that no single nation, ministry or organization can solve food insecurity, rising level of infectious disease, antimicrobial resistance, the scourge, and the requirement, the urgent need for a stewardship in that direction, environmental pollution, or any other grand planetary health care challenge alone. No government is not going to be just whole of government or whole of society. It's got to be whole of the entire planet to address planetary health. Collaboration is key, and I'm glad to welcome all of you who share the same vision today in this conversation. This is why I said earlier that the theme of this meeting is stark but urgent and necessary. The government can lay out the policy framework, Malaysia Madani, the National Planetary Health Action Plan, which is in the pipeline, and our treaty commitments provide just that. But the academia, the private sector, communication and behavioral change expert, and other stakeholders all need to play their part, not only in Malaysia, but across the planet as well. All hands on the deck. Excellencies, ladies and gentlemen, I want to stress that Malaysia is deeply interested in what you are doing right now. Over the next 3 days or 4 days, you will be engaged in provocative debates, discourses, share groundbreaking research findings, explore innovative solutions, and add depth and breadth to the planetary health vision. In the face of these growing health challenges, we must work to bridge the gap between evidence and action and translate scientific knowledge into practical solutions. The 4 focus areas of this summit have been carefully chosen with this in mind. Namely, actions require good governance, as I've said, an imperative. Planetary health at its core is a social justice issue, a human right. Strong, transparent, and accountable institutions, regardless of administrative level, are needed to ensure the planetary health future that we aim for. Governance must also be deeply rooted in equity, recognizing that those vulnerable to environmental changes often possess the invaluable knowledge that we must treat them as key partners in finding solutions. Secondly, action requires clear, effective, strategic communication. Science, while crucial, must be presented in ways that people understand, that policymakers can engage with, and that our leaders can use to make informed decisions. The storytellers, the filmmakers, the youth leaders and educators that we have in this hall, in this conference, in this summit, today hold an immense responsibility to translate science and research into stories, social media posts, newspaper articles, and policy briefs that capture hope and offer positive possibilities against the current backdrop of fear and uncertainty. Information must be mobilized at all levels. Information must mobilize us all together rather than confuse us and at times be a bit alarming as to paralyze us. That we must clearly avoid. Thirdly, action requires innovation and an education revolution. Gone are the days of chalk and talk. We need to cultivate a new generation of critical thinkers, problem solvers, and innovators that understand that responsible economics and planetary stewardship starts with respecting and valuing the planet's finite natural resources. And lastly, action requires collaboration, and this involves a transformation of the business model. The private sector is starting to wake up to the centrality of its role in creating and embracing a new paradigm, a new narrative, a new worldview that places environmental responsibility alongside economic growth. They need not be mutually exclusive, but rather must be work in tandem. Excellencies, ladies and gentlemen, the solutions we seek for lie not just in policy, changes or technological advancements, but in a fundamental shift in our relationship with the planet. This is the greatest challenge. Could we redefine our relationship with the planet that we have taken for granted for far too long? Together, we can and must make Farm 2024 a catalyst for transformative change with lasting outcomes. Let us confront realities with courage, the audacity, creativity, and unwavering commitments. Let us ensure that a healthier planet for ourselves and generations to come. I thank you.
Thank you.